A pleasant day, everyone. My name is Cristome Alatienza, and today I will be presenting the importance of infection prevention for healthcare workers. To begin with, we must acknowledge the reality of our time. So, for our introduction, as time goes by, the current generation of our healthcare workers and the public alike have entered an unprecedented era of infection disease spreads across the globe. So when you say unprecedented era, you refer to a time marked by a unique or significant challenges. So simply put, we are currently living in a period defined by the rapid and widespread transmission of infection diseases. Okay, so consequently, there has been an increasing demand for healthcare associated infection or the HAI prevention and control due to several critical factors such as first, improper sanitation, second, immunosuppression in patients, third, higher mortality rate, and lastly is the prolonged hospitalization. Okay. A prime example of that is the impact of COVID-19, which affect not just our immediate society, but the entire world. This really significantly highlights why infection prevention and control, or IPC, is non-negotiable for healthcare workers. Okay, so before I proceed to the main purpose and impact, let me clarify some crucial terms relevant to our topic. The first term is the first infection prevention and control, or the IPC. This refers to a practical, evidence-based, and discipline concerned with preventing or stopping the spread of infection. The second term is the healthcare associated infection or the HAI. This is defined as a disease acquired by a person while receiving treatment in a hospital or clinical setting. And next, let's now expand on the purpose of infection prevention and control. Primarily, IPC serves as the framework and foundation to mitigate the impact of healthcare-associated infection. Thereby, it ensures the patient safety. Furthermore, the World Health Organization or the WHO introduced IPC to reduce disease transmission, which aims to stop the spread of pathogens through direct contact, indirect contact with contaminated objects, and even transmission across various environments called airborne transmission. Finally, let's move to the core concept of this presentation, which is the importance of infection prevention for healthcare workers. So, first, it provides a comforting and safe environment for patients, which allows healthcare facilities to serve as trustworthy pillar of public health, which is the ultimate goal of the healthcare system. Secondly, IPC demonstrates the healthcare worker as a human too. This means that every worker's health matters. Their lives are just as valuable as the clients they serve. Therefore, infection prevention is vital given the current global situation. Healthcare professionals are different disciplines, specifically nurses, have a responsibility to be coherently educated on all elements of nursing practice, supported by the latest scientific knowledge and theory-based research. The importance of infection prevention are represented by demonstrating of wearing gloves, protective equipment, which are critical barrier preventing the transfer of pathogens between the patients and ourselves. Okay? Such as gloves to prevent contact transmission and face masks to shield our mouthful surfaces. Second is the hand hygiene, which is arguably the single most effective action in breaking the chain of infection. This is a discipline approach ensuring that we clean our hands before touching a patient, before a clean procedure, after body fluid exposure, after touching a patient, and after touching the patient's surroundings. The third one, which is the last, is the cleaning and disinfecting the environment reduces. Um, reduces the reservoir of microorganisms, securing the physical space where care is delivered. Okay. Summary, infection prevention and control for healthcare workers is not optional. It is a mandatory task for the reason that it unifies the foundation of safe, ethical, high quality care for everyone. The other one is healthcare workers are the frontliners, possessing the knowledge and skills to promote health and wellness, serves as inspiration to the public. This influenced them to properly manage signs and symptoms before microorganisms have the chance to transmit it to others. And lastly, this represents a commitment, a dedication to the compassion of every healthcare workers. By giving importance to ITC, we sustain the health system and preserve the essential workforce that provides holistic care for all. So let me end this presentation by setting a reminder about this topic. First reminder is adhering to infection protocol is the conventional response to the calling of healthcare professionals. It is our shared responsibility to take care of our own self just as diligently as we take care of others. And finally, never forget that the infection prevention is the silent guardian of both healthcare workers and patient safety. It works quietly in the background, but it is the shield that keeps us all safe. Okay, thank you for listening. I hope that you learned something for today.